In previous lecture, we started the next unit, antiseptic and disinfectant from the pharmacology and toxicology. In this unit, we discuss firstly definition of antiseptic and disinfectant. So these are the chemical agents. Whenever antiseptic, these are the agents, they causes destruction or inhibition of growth of microorganisms. Growth of microorganisms such as bacteria, viruses, fungi on the living surface such as skin and mucous membrane is known as antiseptic. Then second, disinfectant. These are the agent that causes destruction and inhibition of the growth of microorganisms, that is bacteria, viruses, fungi on the non-living surface is known as disinfectant. After that, we discuss their ideal properties, how it should be. Whenever we use antiseptic and disinfectant preparation, then they possess the following properties. That is, it should have wide spectrum and sidal activity, non-irritating, it is active at any pH, it should be stable. All these properties we discuss. After that, main point in this chapter, an important one. Question is asked on this point. Define and classify antiseptic. Write the difference in between antiseptic and disinfectant. So we discuss difference in between antiseptic and disinfectant, in which their application on non-living tissue, living surfaces, animate object, inanimate object. Either they kill the bacteria, they prevent the growth of bacteria, then they do not causes any irritation, they causes irritation. So this point we discuss in their difference. After that, we discuss classification, in which mainly it is classified into two main classes, in which first one is physical agent and second one is chemical agent. Physical agent, their example, heat and ultraviolet light. And in chemical agent, they are classified into these 11 classes, in which first one acid, oxidizing agent, phenolic compound, that is phenol derivative, surfactant, alcohol, halogen, aldehyde, antiseptic dyes, heavy metals, antibiotic, and miscellaneous compound. So let's see the one by one classification, how they are used and how they shows their role as an antiseptic or disinfectant agent and their preparation dose. So in which it should be start from the physical agent. In the physical agent, heat and ultraviolet light. So by producing heat, there is growth of microbes or any bacteria is to be prevented. So heat, it is a most important sterilizing agent. What is meant by sterilization?
Free from microorganism.
Enlist methods used for sterilization.
Moist sterilization, dry heat sterilization, chemical sterilization.
Other methods. We can sterilize only by using these two, moist heat and dry heat.
Chemical sterilization.
Filtration sterilization. Radiation sterilization. Chemical agent by using the chemicals, that is chemical sterilization. Is it covered in hospital sterilization?
Yes, ma'am. Yes, ma'am.
Then enlist all the methods. Can anyone enlist all the methods of sterilization? Roll number 52, are you present?
Yes, ma'am.
Enlist all the methods.
Physical method, in which three types:
First one.
Heat, radiation, and filtration, in which heat is divided in two types: dry heat and moist heat. In dry heat sterilization, there is hot air oven. Example, moist heat sterilization मध्ये autoclave यूज करून केलं जातं स्टरलायझेशन. रेडिएशन मध्ये रेडिएशन एक टाइप आणि फिल्ट्रेशन मध्ये व्हेरियस टाइपचे फिल्टर वापरून स्टरलायझेशन केलं जातं. मेम्ब्रेन फिल्टर.
Okay, also tantalization, pasteurization. This process are also involved in the sterilization. So this heat, it is a most important sterilizing agent. It is helpful to inhibit the growth of microbes, either it is bacteria, fungi, or the viruses. The next point, it may be applied either in the moist heat or the dry heat. When it is moist heat, then instrument is known as
hot air
moist heat, hot air oven or autoclave.
autoclave.
Confirm autoclave.
Yes, madam.
Yes, ma'am.
Moist heat sterilization. I think this equipment autoclave you all already used in practicals of HCP. So autoclave, it produces moist heat sterilization and it remove all the presence of microbes from this instrument or any inanimate object. So that's why this as a physical agent, this heat is to be used and heat is applied either in the moist form or either in the dry form. So that is dry heat and the moist heat. So moist heat, it is equipment used autoclave. Through the autoclave, moist heat is to be produced and dry heat, that is hot air oven. Then pasteurization, that is boiling in the water, steam are several ways by which the moist heat can be applied. So pasteurization, it is also process involved in the sterilization of any inanimate object in which boiling of the water is to be done at the particular temperature, and it may be 100 degrees Celsius, and then remove of this microbes presence on this non-living surface. The next point, the various materials that can be sterilized by moist heat are dressing pads, that is surgical dressing pads, surgical instrument, laboratory equipment, culture media, and pharmaceutical products. So all this equipment, that is products, equipments, they are sterilized by using this by using either moist heat sterilization or dry heat sterilization, or heat, it is used as a physical agent to sterilize the dressing packs, surgical dressing, surgical instrument, laboratory equipment, culture media. Do you know culture media? Culture media. They are used in the microbiology practicals. Where growth of microbes is to be checked out. And culture media, it provides as a growth media to observe the growth of microbes or not. So in the culture media, there is specific nutrients are provided for the growth of microorganisms such as either bacteria or the fungi. So storage or proper sterilization of this culture media, pharmaceutical product, this heat is used as a sterilization or used as an antiseptic to remove all the types of the bacteria or fungi or the microbes present in it. The next point, dry heat can be used in several ways like flaming, incineration, and hot air. What is meant by incineration? Flaming, माहित असेल. Incineration means sound is audible to all.
Yes, ma'am.
What is mean by incineration? Physical agent in which heat, this part already covered in sterilization in their methods. Incineration, flaming, hot air oven. Clear nahi. Okay. So incineration, it is a process in which remove of the microorganism from any inanimate object by there is given a treatment, waste treatment. It involves there is combustion of this substance and which contain a waste material. So after the combustion, ज्यात such instrument equipment आहे ते sterilize होतं. Then hot air oven, glass syringes. Okay, glass syringes autoclave नी sterilize केले जातील की dry heat नी, hot air oven नी. Glass syringes. So question असेल तुम्हाला glassware sterilized by using hot air oven or any other method.
Autoclave.
Sterilization.
Why glassware sterilized by using autoclave? चॅप्टर मध्ये भरपूर काय आहे coagulation of protein, how sterilization mechanism is done, then which particular equipment is sterilized by using which particular method. Example wise आहे झालेलं का? And also question is asked on this point for sterilization of syringes, for sterilization of glassware, for sterilization of hand gloves, which of the following method of sterilization is to be used? And their options of all the methods is to be given below. So for hand gloves, which sterilization method is to be used?
Moist heat sterilization using autoclave.
Why? Why?
कारण heat sterilization मध्ये ते melt होईल ना. Using moist heat
It gets
sterilization.
burned when we use the dry heat. That's why it is sterilized by autoclave, that is moist heat sterilization. What is the mechanism or principle of hot air oven or autoclave? How autoclave, that is moist heat sterilization, kill that bacteria? Hand gloves आहेत त्याच्यावरती microbes present आहेत and we sterilize this putting into the autoclave. Then काय करतं autoclave, how it will work? तेवढा
Under
deep study केलेला नाही.
sterilization केलं जातं.
Repeat again.
Under steam pressure sterilization केलं जातं. Autoclave मध्ये.
And coagulation happens in which method? Coagulation of protein.
Autoclave मध्येच.
माहिती प्रिन्सिपल सगळ्यांना? In the autoclave, that particular instrument or the equipment is, or that particular inanimate object, it is exposed into the autoclave and there is direct contact of steam with this inanimate object under the specified temperature and specified pressure, and it is for the particular time. So किती असतं temperature?
Autoclave 120.
121 degrees Celsius. 121 degree.
Pressure
15
15 laps.
15.
15 na?
LB lab.
15 LB.
Okay, so autoclave, it works on the principle of moist heat sterilization where steam under the pressure, it is used to sterilize that material which is placed inside the chamber, and when the steam comes in contact with the surface of inanimate object, then it kills the growth of microbes or kill that microbes and inhibit the microbes at the particular inanimate object and it gets sterilized. So this glass syringes, instrument, laboratory glasswares, and glasswares particularly sterilized by using moist heat sterilization, because when they we sterilize by using dry heat sterilization, then there may be chances to break this glassware. That's why they are sterilized by moist heat sterilization. Then the method of disinfection by using UV rays is highly costly. जे डिसइन्फेक्शन साठी मेथड असते UV rays अल्ट्राव्हायोलेट रेडिएशन मध्ये इन दिस मेथड it is costly or expensive. So this is about dry or moist heat sterilization. Physical agent in which heat and UV light, they both act as anti-infective, antiseptic agent and to inhibit the growth of microbes presence on the inanimate object. So you can write in this point, what do you know from the sterilization chapter? And also now we discuss about how it will work. All this point you can write in the heat. Then next point is in their classification. Second class is chemical agents, in which first one is acid. Screen is visible to all.
Yes, ma'am.
Yes, ma'am.
Physical agent in which heat and ultraviolet light. समजलेलं आहे?
Yes, ma'am.
Do you understand from the physical heat? Physical
Yes, ma'am.
agent in which heat. There are different methods are used for sterilization. Sterilization again having the same role. This process performs the same role as that of antiseptic. Antiseptic काय करतात? Prevent the growth of microbes. Also sterilization मध्ये काय करायचं आहे? That particular inanimate object make free from the all the type of microbes or the organism. So both having the same effect or same therapeutic function. So you have to explain about sterilization in dry heat. Then next important terminologies and we discuss, and after that chemical agents we discuss. So first one, bactericides. Means these are the agents, they are used to kill the bacteria. Sides means kill. All are present?
Yes, ma'am.
Yes,
Yes,
ma'am.
ma'am.
Listen it carefully. These are the important terminology in which bactericides, they kills the bacteria, bacteriostatic. These are the agents, they prevent the growth of bacteria. Fungicides means these are the agents, they kill the fungi or the spores. Then fungistatic means they prevent the fungal proliferation, that is fungal growth. Then germicides, they kills the microorganism. Virucides, these are the agent, they kills the virus. Then sporicides, these are the agent, they kills the spores. Algicides, these are the agent, they kills algae. So for all this terminology you have to remember sides. Sidals means killing and static means just only about preventing or inhibiting action. Antibiotic means they are produced by act against the microbes. So these are the agent. Antibiotics are the agent. They are prepared from the one type of the microorganism and they are used to kill another type of the microbes. Then last one, antisepsis. That is, it is in which destruction of microorganism but not a spores or back on the living tissue. Means antisepsis, antiseptic only act related to prevention or inhibition of growth of microbes. They do not kill the spores, while disinfectant directly kill that microbes or kill their spores, means where they originated. That spores is also killed by disinfectant. The next point, different. Okay, how the antiseptic and disinfectant act, that is mechanism of action in which oxidation of bacterial protoplasm. So to understand this mechanism of action, you know about what is structure of cell, bacteria, cell component, protoplasm, cell wall, plasma membrane. So on this, all the component of this bacterial cell wall where this agent is to be act, and they shows particular their action and inhibit the growth of microbes. In which first one, oxidation of bacterial protoplasm. Their example, potassium permanganate, hydrogen peroxides, and some halogens. In halogen, either it is chlorine, iodine, or iodophore. Oxidation. What is mean by oxidation?
Oxidation means loss of electron.
Another one,
Gain of oxygen.
okay. So gain of oxidation of bacterial protoplasm. So bacterial cell wall, in there is protoplasm of this bacteria, where oxidation is occur by after the application of this antiseptic and disinfectant, and they shows their particular action, that is to prevent the growth of these microbes. Then next one is coagulation, that is denaturation of bacterial protein. हे जर पॉइंट मेकॅनिझम किंवा प्रिन्सिपल मध्ये नसतील, मार्क्स भेटत नाहीत. Denaturation, coagulation, oxidation. So coagulation, that is denaturation of bacterial protein and disrupt the cell membrane. The cell membrane disturb झालं तर बॅक्टेरियाची प्रॉपर ग्रोथ होईल का?
No.
Denaturation means breaking of that linkage, जे cell membrane जे आहे त्याचं ब्रेकिंग झालं, then this bacteria survive or not? Cell membrane, cell, bacteria component आहे का important? सेल मेम्ब्रेन माहिती आहे की नाही?
Yes, ma'am.
सेल मेम्ब्रेन composed of 12th मध्ये झालेलं आहे बायो मध्ये. सेल मेम्ब्रेन इट इज composed of
Lipoprotein.
fatty acids, lipids, proteins, phospholipids, so on which this antiseptic is to be act, and where coagulation is to be occur or denaturation is to be occur. जे पॉइंट समजत नाही ते राईट डाऊन करा, समजत असतील तरी राईट डाऊन करा. So denaturation of protein means there is breaking of this protein or lipid layer on this bacterial cell. But तो layer जर का disturb झाला, if destroy this layer, at that time there is not growth or no growth is to be occur, and that bacteria cannot be survived. By this way, this agent act as an antiseptic and disinfectant. The next one, detergents like action increases the permeability of bacterial cell membrane. So their examples are citramides and soaps. These agents, they are from the classification in the surfactant class, that is surface active agent. This agent increases the permeability of cell membrane by producing the effect antiseptic and disinfectant. So this is mechanism of action of antiseptic and disinfectant. They perform oxidation of bacterial protoplasm, coagulation, that is denaturation, and also they increases the permeability, and by this way they act as an antiseptic agent. Then let's see the next point, chemical agent, in which in first class physical agent and second class chemical agent, in which first one is acids. दोन क्लास आहेत मेन, त्याच्यामध्ये फर्स्ट क्लास फिजिकल एजंट, सेकंड वन केमिकल एजंट. केमिकल एजंट मध्ये फर्स्ट क्लास acids, in which boric acid, benzoic acid, mandelic acid, salicylic acid. These acids act as a chemical agent, as an antiseptic and disinfectant. So in this we have to study their use and their preparation. Screen is visible to all.
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
What are the examples of acids?
Salicylic acid, boric acid,
Boric
benzoic
acid,
acid,
benzoic
mandelic.
acid.
Chemical agent, they are classified into sub-classified into 11 classes, in which first one acids, in their example boric acid, benzoic acid, mandelic acid, and salicylic acid. So salicylic acid, it has their pharmacology, it has weak bacteriostatic and antifungal action. Bacteriostatic means what? From this terminology, you get idea what is meant by bacteriostatic.
Prevent growth of bacteria.
The growth of bacteria.
And antifungal,
To treat
antifungal
fungal
agent. Antifungal agent means
To treat the fungal infection.
to treat the fungal infection. This is pharmacology. In one sentence, you have to only write down the pharmacology of this agent, but in detail, whenever question is asked on the right and mechanism of action of antiseptic and disinfectant, then you have to write this point and also add the point from the sterilization, that is coagulation, principle of autoclave. This point you have to add in it. Then next, uses. In their uses, it is used as a keratolytic and for removal of cones or the warts. What is meant by keratolytic? Keratolytic माहिती है? As a keratolytic, salicylic acid used as a keratolytic means it is used in treatment of remove of warts or lesions on the skin. WARTS, warts माहिती है का? Warts on the skin. Sound is audible to all?
Yes, ma'am.
Do you know about cones and the warts on the skin? Yes or no?
No, ma'am.
No, ma'am.
Warts and it is used as a keratolytic. Keratolytic means there is presence of any small or remove of the warts. Keratolytic means these are the agents they are used to treat in the treatment to remove the warts and the cones. So the next one is for removal of cones and the warts. Cones and wart means there is small fleshy like structure is observed on the skin. On epidermis layer of the skin, that is warts, and they are caused due to the stain of the human or a papilloma virus. There is fleshy bump occur on the mucous membrane or on the skin. So this salicylic acid, it is an example of the acid in which it is used as a keratolytic, means it is used in treatment of it is used in the keratolytic therapy to treat or to remove the any cones or the warts from the skin. So that is warts on the skin, they are the small hard benign growth occur on the skin and it is caused due to the virus. So this is cones and the warts. The next one is preparation dose 1 to 5% as a ointment. So in the form of ointment, this is used as an antiseptic and disinfectant. The next example from the acid is benzoic acid. Again, its pharmacology, it acts as a bacteriostatic. Bacteriostatic means these are the agents, they inhibit, prevent the growth of bacteria. Then uses, it is used as a preservative in foods and the drinks. Antifungal in treatment of ringworm infection of skin. If there is ringworm infection occur to the skin, worms might still. Vermicidals, antihelminthiasis, roundworm, tapeworm, ringworm. माहिती है?
Yes, ma'am.
Yes, ma'am.
So this benzoic acid, it is used as an antifungal agent in treatment of if any infection occurred due to the ringworm. And it is used as a preservative. What is meant by preservative? It is used as a preservative in foods and the drinks. So what is meant by preservative?
Prevent growth of microorganisms in food and drinks.
Okay, so these are the agent. They are chemical agent or the substances. They are added into the food or any drinks that prevent the spoiling of this food or drink. So to improve their appearance and to remove the spoiling or to escape or to prevent the spoiling of this food and drink, these acids are used in some food and drinks. Generally, in which food product preservative is to be added? Preservatives added in which foods? Any idea?
Pickles.
Next. आईस्क्रीम मध्ये असतात का प्रिझर्वेटिव्ह? Yes or no? चिप्स मध्ये?
Yes, ma'am.
Yes, ma'am.
Acid means as such acid नसतं. Again their conversion form is to be done. Other processes असतात and after that they are just applied with the essence. Essence माहिती आहे? Flavors.
Yes,
Yes,
ma'am.
Yes, ma'am.
So with this, these preservatives are added. Chips and also pickles, ice creams, and other foods and drinks. Drinks मध्ये preservatives असतात. Then their dose, preparation dose is to be 0.1% to 3%. Then boric acid. It is weak bacteriostatic agent. Then uses antiseptic eye ointment. What is mean by ointment? Voice is audible to all.
Yes, madam.
What is mean by ointment? Roll number 50.
Ointment are semi-solid preparation meant for external use for skin or mucous membrane.
Ointment are
Semi-solid preparation.
okay. So in antiseptic eye ointment, this acids, boric acid is to be used as a antiseptic. Also, it is added in the eye lotion. Preparation केले तो ointment चे. Experiment झालेत का? Boric
ma'am.
acid.
Yes, ma'am.
आहे का तुझ्यामध्ये acid, zinc oxide, boric acid. Formulation table मध्ये असेल. So in antiseptic eye ointment, this boric acid is to be used as an antiseptic. Also, it is added in eye lotion. What is meant by lotion? It is solid formulation or semi-solid or liquid.
Liquid preparation.
Liquid preparation.
Throat paint. काय आहे हे?
Liquid preparation.
I think all this formulation already covered in pharmaceutics. So this throat paint, these are the preparation. They are used to remove the pain, irritation of the throat without swelling or sore throat जे आहे ते decrease करण्यासाठी to reduce this pain. These throat paints are used. So in this all the formulation, eye lotion, ear drop, eye ointment, and throat paint, these antiseptics are used. Then preparation dose 1 to 5%. Then next class is oxidizing agent, in which potassium permanganate. Their example, oxidizing agent, their examples are potassium permanganate, hydrogen peroxide, sodium perborate, in which first one is potassium permanganate. Roll number 32, are you present? Are you present? Read the slide. Potassium permanganate uses, read करा. Sound is audible to all?
Yes, ma'am. Yes, ma'am.
Roll number 32, read the slide. Otherwise, you can leave the lecture. 33. 31.
Yes, madam.
Roll number 20.
Yes,
Read
ma'am.
about oxidizing agent.
Potassium permanganate uses disinfectant and deodorants to disinfect ponds and wells, to disinfect bedpans and septic discharges. One has 200, one has to 500 solutions of 1 has to 4,000 to 1 has to 1,000 are used to gargles or mouthwash in stomatitis. Dilute solutions are used to bladder or urethral wash for gastric lavage in the case of poison.
Okay, so in oxidizing agent, their examples are potassium permanganate, hydrogen peroxide, and sodium perborate, in which first one is potassium permanganate. Their uses are given as follows as a disinfectant and deodorant. So disinfectant, as you know from the definition, where deodorant are the agents. They are used or the substances, they remove the unpleasant smell, or they remove the badly smells or badly odors. That is deodorant. So for this purpose, the potassium permanganate is to be used. Then it is used to disinfect the ponds and wells. माहिती आहे का ponds and well? White side.
Yes, ma'am.
Okay. Then to disinfect bed pans and septic discharge. Antiseptic discharge, that related septic discharge. So to disinfect these ponds, wells, to disinfect bed pans and septic discharges, this potassium permanganate, it is used as a disinfectant. Then 1:200, 1:500 solution of 1:4,000 and 1:1,000 are used to gargle and mouthwashes in somatitis. So their proportion is to be given to gargle or mouth. Gargles माहिती आहेत? Mouth washes, gargles माहिती आहेत का?
Yes, ma'am.
Then to treat the stomatitis means to treat the oral mucositis. That is, it is any condition in which painful swelling and sore inside the mouth. इथे ट्रीट करण्यासाठी गार्गल्स आणि माउथ वॉशेस जे प्रिपरेशन आहे. In this preparation, potassium permanganate is to be given by this proportion 1:1000, 1:500 solution of 1:4000 and 1:1000. Then dilute solution are used as a bladder or urethral wash. So this diluted solution of potassium permanganate, it is used as a bladder or urethral wash. The next point for gastric lavage in case of poisoning. म्हणजे poisoning बघितलेत, salicylate poisoning, atropine poisoning, barbiturate poisoning, organophosphorus poisoning, त्याच्यामध्ये झालेलं आहे. Gastric lavage is to be done. So this potassium permanganate, it is used for the gastric lavage in the case of poisoning. Then next, hydrogen peroxide. In which it is used for cleaning the wounds. The next point, as a mouthwash and deodorant in aphthous stomatitis, tonsillitis, and diphtheria. What is mean by diphtheria? It is caused due to diphtheria means anyone sound is audible to all.
Yes, ma'am.
Yes, ma'am.
Diphtheria काय आहे? तुमचे डिसीज क्लिअर नाहीत, बॉडी पार्ट ही क्लिअर नाहीत. एनीवन डिप्थेरिया काय आहे? I think this is also covered in health education first year. आणि त्याच्यामध्ये डिसीजच्या रिलेटेड जास्त आहे. फर्स्ट pathophysiology, after that sign and symptoms, and then next point is treatment. The treatment तरी राहू द्या, तुम्हाला डिसऑर्डरच माहित नाही.
Infection of nose, throat.
It is infection to the nose and throat. मराठीमध्ये काय डिप्थेरिया? टीबी काय आहे मराठीमध्ये? डिप्थेरिया गटसर्प मराठीमध्ये. टीबी मीन्स
क्षयरोग.
ट्युबरक्युलोसिस. लेप्रेसी
कुष्ठरोग.
कुष्ठरोग.
डिप्थेरिया
गटसर्प.
it is mainly disorder affected to which system? Diphtheria affected to respiratory system.
Respiratory system.
So diphtheria, it is a serious infection. It is caused due to which species? Corynebacterium diphtheria. It is a bacterial species, and because of this, diphtheria is to be occur. Tonsillitis means what?
Inflammation to the tonsils.
To the tonsil.
Tonsillitis, it is usually caused due to the viral infection. So there is inflammation to the tonsils. Then next, stomatitis. Stomatitis means
Painful swelling in mouth.
so in such a disorder, this hydrogen peroxide is to be used. Then next, in dental practice as a cleanser and help to remove stain from the teeth. So firstly, it is used as a cleaning of the wounds. Then next one, it is used in mouthwashes and deodorants and in stomatitis disorder, then tonsillitis and diphtheria. Also, it is used in the dental practices as a cleanser to clean the teeth, and it helps to remove stain from the teeth. So these are the uses or application of hydrogen peroxide as an antiseptic agent. Aphthostomatitis means there is inflammation or irritation to the gums, mouth cavity. The next point, fourth class is phenolic compound, that is phenol derivative, in which the example is phenol, Dettol, cresol. Screen is visible.
Yes, ma'am.
Yes, ma'am.
So first one, it is used as a local antiseptic. So local antiseptic means these are the agents they applied particular local area and where they produces effect, that is they remove the presence of microbes, fungi or the viruses, is known as local antiseptic. So this phenol is act as a local antiseptic. Then next, as a disinfectant against gram-positive and gram-negative bacteria. That as a disinfectant, this phenol, it is used as a disinfectant, that is to remove the presence of bacteria and from the non-living surface or inanimate object against gram-positive and gram-negative bacteria. Gram-positive and gram-negative. काय आहेत examples? Positive मध्ये काय येतात? What are the examples in gram-positive bacteria? काय डिफरन्स ग्राम पॉझिटिव्ह आणि ग्राम निगेटिव्ह मध्ये? Can anyone tell me about any one difference point related to gram positive and gram negative bacteria? It is related to structure. त्याच्यामध्ये चेंजेस आहेत. Peptidic glycan layer in gram positive bacteria it is thick while in gram negative bacteria is thin. काय माहिती आहे तुम्हाला ग्राम पॉझिटिव्ह आणि ग्राम निगेटिव्ह रिलेटेड? की फक्त नेम माहिती आहे ग्राम पॉझिटिव्ह आणि ग्राम निगेटिव्ह? Sound is audible to all?
Yes, ma'am.
What is difference in between gram positive and gram negative bacteria? तुम्ही कधी डीप मध्ये गेलाच नाही, फर्स्ट इयरला तसंच केलं आणि 12th मध्ये सेम आहेत. समोर पॉइंट जस्ट ओके, इट इज यूज्ड ॲज अ disinfectant, बट व्हाय, व्हेन, वेअर हे क्वेश्चन विचारले तर डीप मध्ये जातं. What is gram positive? What is gram negative? हे फक्त आहे अगेन्स्ट ग्राम पॉझिटिव्ह अगेन्स्ट ग्राम निगेटिव्ह ऍक्सेस राईट डाऊन करायचं. इट इज ओनली रिलेटेड लक्षात राहिलं एक्झाम मध्ये लिहिलं अदरवाईज गेलं. जर ह्या वेळी तुमचं प्रिपरेशन असेल ऍट दी एंड तुम्ही ज्यावेळेस पास होताल नाही होताल तुम्हाला माहिती सो कन्सिडर की तुम्ही पास होताय. आणि ज्यावेळेस तुम्ही फक्त पास आउट होऊन फार्मासिस्ट होणार आहे जे मेन आहे यू हॅव टू बिकम अ रजिस्टर्ड फार्मासिस्ट. तर ते होण्यासाठी जी एक्झिट एक्झाम आहे त्यावेळेस तुम्हाला आठवेल कोलॉजीचे लेक्चर. मग एक्झिट एक्झाम मध्ये पास आउट क्लिअर झाला तर तुम्ही रजिस्टर्ड फार्मासिस्ट आहात. and when you get and you are liable to get a license. एक्झिट एक्झाम मध्येच काही नाही आलं काय करणार आहे की परत कंटिन्यू ती रिपीट करायची डिप्लोमा कंटिन्यू करायचा. you. So it is used as a local antiseptic disinfectant and it is effective. It is used as a disinfectant against the gram-positive and gram-negative bacteria. So there are many examples involved in the gram-positive and gram-negative bacteria, and majorly gram-positive and gram-negative bacteria. Their distinguish is given by considering the different parameters such as cell wall. If we consider the cell wall parameter, and in gram-positive bacteria, cell wall structure is in the single layer, while in gram-negative bacteria, their structure of this gram-negative bacteria, it is in the double layer. Then peptidoglycan layer, it is thick in the gram-positive bacteria. It is thin in the gram-negative bacteria. Then lipid content in the gram-positive bacteria is to be very low, while in gram-negative bacteria is to be 20 to 30%. Gram-positive bacteria is very susceptible to antibiotic, while gram-negative bacteria, the resistance to the antibiotic. So mainly there are many points involved in difference in between gram-positive and gram-negative bacteria, and there are certain different examples are involved in it, such as Streptococcus, Bacillus. These are the examples, and also Streptococcus leprae, Streptococci, Pneumococci, Cocci, Bacilli. These are the examples involved in the gram-positive or gram-negative bacteria. The next point, it is effective against fungus and viruses. This phenol effective against fungi and viruses. Then next is Dettol, as you all know, and also you all used this preparation for hand wash. माहिती आहे यूज केले का?
Yes, ma'am.
Yes, ma'am.
So this is again in the example of phenolic derivative. It is used as an antiseptic as a germicide. Germicide means to kill the germs present on the skin or on the hand. Then it is used for cleansing the wounds clean करण्यासाठी Dettol use केलं जातं. Also their main component is chloroxylenol. This is important one asked for MCQ, which is main API involved or contain Dettol. So their example is this main constituent is chloroxylenol. Then next point, 5% of solution with the 70% of alcohol is used for disinfection for the surgical instrument. Surgical instrument ला clean करण्यासाठी disinfect करण्यासाठी 5% चं Dettol 70% च्या alcohol मध्ये mix केलं जातं and it is used to disinfect this surgical instrument. Tell me the examples of disinfectant which you know. तुम्हाला माहित असलेले disinfectant सांगा. I think disinfectants are available in everyone's home. आहेत का?
Lysol.
Colin.
Care and hygiene, disinfectant liquid for the safe, gentle, effective, concentrated liquid. Lysols, majorly used as a disinfectant. The next one is halogens. Okay, one more examples from the phenolic compound is to be remaining, that is cresol, CRESOL, cresol. So it is used as a commercial disinfectant and preservative in medicinal preparation. The medicinal preparations मध्ये as a preservative and as a disinfectant म्हणून use केलं जातं. Then next also resorcinol. Resorcinol it is also used as an antiseptic ointment. Then hexyresorcinol, it is used as an antihelmintic. Antihelmintics means helminthiasis. Helminthics means antihelminthiasis agent झालेलं आहे का पीसी मध्ये? पीसी सेकंड झालेलं आहे का helminthiasis disease? Am I audible to all?
Yes, ma'am. झालं.
Yes, ma'am.
Yes, ma'am.
What is mean by helminthiasis? And what is mean by antihelminthic agent? Which agent act as antihelmintics?
Antihelmintic drug that act against infection caused by parasitic worms.
Okay, it is correct. One good. So helminthiasis, it is an infection. It is occur due to the worms. There are different types of the worm. Either it is tapeworm, roundworm, flus. So because of this, infection is to be occur, and to treat such type of the microparasitic disease in either in the human or the animal, the agent used to treat this disorder is known as anthelmintic agent. So this hexyresorcinol, it is used as a anthelmintic, and also it is used in throat lozenges. Any idea about lozenges? It is which type of the formulation?
Solid type. Solid dosage form.
And how it shows their pharmacological action?
They dissolve in mouth.
Okay, good. So lozenges are the solid dosage forms, and they are intended to be dissolved or disintegrate into the mouth. And after that, it reaches to the systemic circulation and shows their therapeutic effect. So in throat lozenges, this hexyresorcinol is to be used. Then next point is halogens. In the halogens, their examples are chlorine, iodine, then iodophores. These are the examples. Screen is visible.
Yes, ma'am.
What are the examples in halogen?
iodine, chlorine, iodophores.
So in which iodine, it is used as an antiseptic. Then next one is chlorine. Chlorine, it is used as a germicidal, and again it is effective against gram positive and the gram negative bacteria. Then next one is chlorinated lime. It is also in the halogens. Their use, it is used as a disinfectant and it is used as a deodorant. Deodorant माहिती है? It is used to remove the bad odor, deodorize. So that's why it's deodorant as a chlorinated lime. It is used as a disinfectant and deodorant. Then next point, it is powerful bactericidal, sporicidal, and fungicidal and virucidal agent. As we discussed, as we seen in the different terms, you know about bactericidal, sporicidal, fungicidal, virucidal. So these halogens are the powerful bactericidal, sporicidal, and fungicidal agents. Then their disadvantage is they are irritating, painful, stain and the area and maybe delay the wound healing. Wound healing ची process आहे त्याला prolonged time करतात. That is delay the wound healing. They are irritating, painful, stains formation is to be occur after their application. So these are the disadvantages. Then next one is uses of iodine. Roll number 34. Are you present? 34.
Yes,
Tuja
ma'am.
Pardon, are you present?
Yes, ma'am.
Uses of iodine.
Has a stencher used before surgeries to the clean the skin. Then Mandel's painter treatments of tonsillitis and
Pharyngitis. Larynx.
pharyngitis. Then iodine ointments in the ringworm of infection.
Okay, so uses of iodine in which first as a tincture and used before the surgery to clean the skin. So before any surgical operations or the surgery, this iodine it is used to clean the skin as a tincture. Tincture means these are the medicines. They are made by dissolving a drug in the alcohol. Alcohol मध्ये drug dissolve करून जे medicines prepare केले जातात, that is tincture, and it is used for the before the surgery to clean the skin. Then next one is Mandel's paint. So this is preparation. It is used in treatment of tonsillitis, that is infection to the tonsils, and pharyngitis. Do you know parts of respiratory system?
Yes, ma'am.
Which parts? Trachea, pharynx, larynx.
Bronchi.
Right?
Yes, ma'am.
So in which if there is infection to the pharynx, then this disorder is to be occur, that is pharyngitis. So to treat this disorder or disease, this Mandel's paint are to be formulated. They are prepared by using iodine. Then next, iodine ointment. They are used in ringworm infection. So these are the uses of halogen as an antiseptic agent. Roll number 33. Are you present? 33, 32.
Yes, ma'am.
Read the slide.
Halogen. It is the powerful bactericidal, sporicidal, fungicidal, and bactericidal agent. Disadvantages: irritation.
Wait, what is meant by fungicidal? What is mean by bactericidal? 32. Roll number 32. I am asking question to you without wasting time. Give me the answer. What is mean by fungicidal? What is mean by bactericidal?
Bactericidal means agent of prevents the growth of bacteria.
Prevent. Cidal means prevent or kill. 32.
Kill.
मग तुम्ही काय सांगताय? आहे का लक्ष लेक्चर मध्ये?
Yes, ma'am.
सायडल आणि स्टॅटिक यातला डिफरन्स समजला नाही आणि लक्ष आहे. मग काय घेतलं लेक्चर मधून तुम्ही? रिमेनिंग पॉइंट्स रीड करा. युजेस and disadvantage.
Disadvantages: irritating, painful stain the area and may delay wound healing. Use of iodine as a tincture used before surgery to clean the skin. Medal spent treatment of tonsils and pharyngitis. Iodine ointment in ringworm infection.
What is mean by tonsillitis? What is mean by pharyngitis? 32.
Inflammation in tons.
Inflammation.
Tonsillitis means inflammation in tons.
Tonsils. And pharyngitis means? Pharyngitis means? Anyone? What is mean by pharyngitis?
Inflammation in pharynx.
32. Okay, let's see the next class. In which next class is aldehydes. What are the examples? Formaldehyde. It is an example. Screen is visible?
Yes, ma'am.
Okay, so aldehyde, the example is formaldehyde. It is act as a effective germicide. Germicide means
Kill the germs.
germicide means they destroy the microorganism. Then next, it is used for disinfection of the surgical instrument. Surgical instrument disinfection करण्यासाठी as a disinfectant म्हणून formaldehyde हे use केले जातात. Then next class is heavy metals. So in the heavy metals, their examples are thiomersol and silver nitrate. So in which silver nitrate it is used for gonococcal ophthalmia in neonates. Neonates means newly born. So gonococcal ophthalmia means gonococcal infection. Gonococcal ophthalmia, that is gonococcal conjunctivitis. Conjunctivitis माहिती है? माहिती आहे की नाही? येस और नो? कंजक्टिव्हायटीज इन जनरल आहे. Seriously, any one of you have no idea about conjunctivitis? Am I audible to all?
Yes, ma'am.
Ma'am, inflammation to the eyes.
काय म्हणतो मराठीमध्ये काय कंजक्टिव्हायटीज मीन्स? आईज ओपन होत नाहीत. So this gonococcal conjunctivitis occur in the neonates, that is in the newborn child. So for this condition, this silver nitrate, it is used as an antiseptic. When cotton swab is to be dipped into this silver nitrate antiseptic solution and it just swipe on the skin, then it will be helpful. So gonococcal conjunctivitis or gonococcal ophthalmia, both are the same, and in which there is infection, it is transmitted by ते इन्फेक्शियस आहे का कंजक्टिव्हायटीस? एकाला झालं तर दुसऱ्याला होतं का? Inflammation or infection to the outer membrane of eyeball and inner eyelid, and there is irritation is produced or inflammation produced to the conjunctiva, that is conjunctivitis. डोळे येणे माहितीये का?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Madam.
That is conjunctivitis. Then next is thimerosal. It is also used as an antiseptic in the heavy metal. So this thimerosal, it is used in sterilization of skin and mucous membrane. Then next, dyes. What are the examples in the dyes? Antiseptic dyes. Example. It is visible in your screen. What are the examples in antiseptic dyes?
Jet and violet.
Jet
Pro-
and violet and proflavin.
Gentian violet dyes and proflavin dyes. So in the gentian violet dye, it is used for disinfection of the skin. It is used to treat the infectious eczema. What is meant by eczema? Eczema, it is disorder related to skin ला जे inflammation होतं, itching sensation. So to treat such type of the infection or the condition, that is eczema, this gentian violet, it is used as a disinfection of the skin and it is used to treat the infection of the eczema. Then next one is acraflavine hydrochloride dye. This dye, it is used in treatment of wounds, burns and other infection of the skin and म्युकस मेम्ब्रेन. जर स्किनला बर्न झालं असेल तर अँटीसेप्टिक क्रीम्स यूज करतात, ऑइंटमेंट्स. माहितीये?
Yes, ma'am.
Okay, so this acraflavine hydrochloride ointment is to be available as an antiseptic and it is applied on the burn skin or any other infection to the skin, and also it is used to treat the wounds. Then next is to be brilliant green. This brilliant green, it is an antiseptic dye. It is used in treatment of the burn of the skin. So this is about dyes. Then next one is antibiotic. In the antibiotic, their example is DDT, that is diclofan, and it is used as an insecticide. Then What are the examples of alcohol?
Ethanol,
Ethanol
isopropanol.
and isopropanol.
So that is ethyl alcohol and isopropyl alcohol. So isopropyl alcohol, it is used as a germicidal, that is to kill the germs, and as a skin disinfectant, and in sterilization of syringes and the needles. So for the sterilization of syringes and needles, isopropyl alcohol is to be used, that is isopropanol. Also, it is used as a germicidal and as a skin disinfectant. Then first one example in alcohol is ethanol, that is ethyl alcohol. That is used as a local antiseptic to prevent the bed sores. It is also used for cleaning the skin prior the parental injection. जे injection द्यायच्या अगोदर the cotton swab, cotton sweep केलं जातं to clean out this particular local area where injection is to be given. So for this ethanol is to be used. Then it may be injected near the nerve to produce the conduction block for the temporary relief of the pain. So temporary relief, pain पासून temporary relief करण्यासाठी to produce a conduction block. So that's why it is injected near to the nerve. Nerve च्या near ethanol or ethyl alcohol हे inject केलं जातं to produce a conduction block, and because of this conduction block there is temporary relief from the pain is to be produced. The next one is citramide. It is under which class?
Quaternary ammonium.
So this citramide, it is used as an antiseptic in quaternary ammonium compound class. It is used for the sterilization of surgical instrument. Also, it is used in pre-operative preparation of the skin. Means operation च्या अगोदर procedure आहे. For this, it is used. Then it is used for disinfection and cleaning of wounds. So these are the uses of citramide. Citramide, it is used for disinfection of the cleansing of wound. Then it is used as a in sterilization of surgical instrument, and it is used as a pre-operative operation preparation of the skin. The next one is benzalkonium chloride. It is used under clothes of the patient suffering from the urinary incontinence to prevent the dermatitis. Dermatitis prevent करण्यासाठी this benzalkonium chloride, it is from the cationic surfactant. It is used to prevent the dermatitis. Dermatitis means what? Dermatitis means dermis, it is layer of
Skin inflammation to the skin.
Inflammation to skin.
okay. So to prevent dermatitis because of urinary incontinence. So this benzalkonium chloride is to be applied under clothes of the patient. They are suffering for the urinary incontinence to prevent the dermatitis, that is inflammation to the skin. Also an rinse for diapers and for bed lines. So also this benzalkonium chloride, it is rinsed into the diapers. Then soaps. In the surfactant soaps, they are used as a germicidal, weak germicidal. Used as a weak germicidal to prevent the microbial growth. Then last class in their classification is miscellaneous compound, and their example is nitrofurazone. So here we complete antiseptic and disinfectant. Okay, before that, commercially available disinfectant and their applications, in which Dettol, it is used as an anti-infective agent. Lysol for floor cleaning. Phenol, it is used in the gargles and mouthwashes. Then chlorothalonol, it is active against streptococci, pneumococci, streptococci, Streptococcus lepri. So these are the different gram-positive and gram-negative bacteria. Then chlorhexidine, their application as a skin disinfectant. So these are commercially available disinfectant and with their application. This chart is important, asked for MCQ. So here complete one by one classification and their uses. So in today's lecture, we discuss about antiseptic and disinfectant in their classification. Mainly it is classified into two main classes. Again, second class chemical agent, it is subclassified into 11 classes, in which first one acid oxidizing agent, phenolic compound, surfactant, in which soaps and cationic surfactant, that is citramide, benzalkonium chloride, alcohol, halogens, aldehydes, antiseptic dyes, in which crystal violet, brilliant green, acroplavin dye, then heavy metals, in which mercury chloride, silver nitrate, antibiotic, bacitracin, neomycin, polymyxin B, miscellaneous nitrofurazone compound. So this is classification. In today's lecture, we discuss firstly heat, how it acts and how it produces that particular and inanimate object is free from the microbes. That is mechanism or principle of this heat. So overall, in antiseptic and disinfectant, we studied, firstly, we learned that definition of antiseptic, what is meant by disinfectant. After that, we discussed ideal properties of antiseptic and disinfectant. Then classification, in their classification one by one class, and their examples with their uses, and some examples having their preparation, that is dose and mechanism of action of antiseptic and disinfectant we discussed. After that, some terms related to antiseptic and disinfectant, bactericidal, virgicidals, spermicidals, bacteriostatic, fungistatic. So these terms we discussed, and at the last point, commercially used formulation of antiseptic and disinfectant we discussed in the today's lecture. Here we complete antiseptic and disinfectant unit from the pharmacology and toxicology. So all of you, any doubt related to this chapter,